important?
Patient-centered care certainly is important because we've got to individualize care. We've got to be able to attend to the patient like there was no other patient available, like there was no other important thing, because the patient before you is the most important thing that you have to attend to at that moment.
It's care that is completely and totally obsessed with the individual. They are the most important person. They may be dirty, they may be smelly, they may be ugly, but they may be a different social class to you, but they are still the most important person you've ever met. It's important because we make fewer mistakes if we attend to patient-centered care. And those mistakes can sometimes be life-threatening. But it also brings about more cost-effective care because you request the right tests for the right patient at the right time, taking into consideration all of the information you've gathered, and you will only be able to, I believe, be able to collect that right information and get the right answers if you practice patient-centered care.
Patient-centered rather than disease-centered. Or in other words, going away from the medical model to a social model. The medical model was more or less oriented towards the disease, while the social model looks at the social determinants of disease, and basically knowing that the patient comes from the community, and the community is within a nation, and the nation is within a globe. So
it's important.
Patient-centered care takes account of the needs of the patient. The doctor will not practice only according to his science, but also what the patient needs for efficient treatment with good results, with participation of the patient, respect of patient's rights, and actually engaging the patient to help the doctor achieve the goals of treatment.
Players. So he should be an all-rounder person who is more focused on all issues, not necessarily medical issues. So we would like this person not necessarily to be disease-oriented, but rather than looking at a holistic approach to care. In other words, looking at total care. In other words, looking at the whole patient, not the disease.
And we also need to ensure that our patients are getting the satisfaction, that they desire, are getting a worthy experience when they come to seek care, and in so doing, we should also be enhancing healthcare seeking behavior, because then they know the experience is worthy their time and effort. So the school has to produce such a doctor that is going to make the patient's experience worthy, is going to be sensitive to the patient's needs, is going to be a professional, and is going to be able to communicate with the patient in a manner that the patient understands, and therefore improves the chances of adherence and the chances of repeat visits if they're necessary. And if you understand the patient, then you later cascade that into the social setting that the patient comes from, then the community elements that may have affected this particular patient. So sometimes well-done patient care provides us the lens to look through to the community, because if we are able to communicate and get as much information from the patient, then we can actually know what the community down there may actually be facing, only that not all have come to us. So patient care is key, and therefore...
So community-oriented care is about the health of the group of people who live within a defined geographical area or who share a common identity, which is to locate myself within a community and always to be a part of that community, and to take an approach.
Yeah, community-oriented meaning that when you see the patient, you know they come from a setting. And if you understand some of the social determinants of health. You know that some of these are actually community-based. You know, so if you see a patient and then another coming in with the same condition, certainly you should be able to ask yourself, where is this community and what is causing this? Then with the right set of skills, you can go out, engage the community, get their feeling about the things that you think could be causing this pattern of patients, and also be able to work with them to find solutions, because the best solutions in health are those that have full participation of the community, especially when we are talking about population-based healthcare. And
we know that healthier communities are trusting communities. So one of the key questions we might ask to test community cohesion or communityness, if that's a word, is to ask a simple question like, do you trust the security of your house with your neighbour? Because the health of an individual affects the health of the community, and the health of the community affects the health of all the individuals within it. Mm-hmm. And you know, when you meet with an individual patient, they are, for those moments you meet them, the single most important human being that you have ever met in your life. And so everything about that consultation is about the person sitting in front of you. And if you realise that, and if you appreciate that, then you don't miss out on the subtleties. You don't miss out on the non-verbal cues. You know, you don't miss out on the unease on someone's face as you're describing something, or when you ask a question, you pick up on the fact that they're actually quite reluctant to give you a truthful answer. And throughout the entire consultation and the whole journey of care, your regard for that person is so high and is so intense that you consider the patient in every step of the way. You don't even let them leave your consulting room without giving them what we sometimes call a safety net. So, you know, we're going to send you for some tests to try and find out what the problem is. I know you're experiencing quite a lot of pain. Here's some medication for the pain. But if things change between now and the time you come back, this is what you can do. You can phone me, you can phone the hospital, you can come directly into the hospital. That, for me, is patient-centred care. In some parts of the world, you have sick communities. In the community that I worked in a city, Glasgow, which is the third poorest, what they call electoral ward in the UK, there were high levels of drug taking, of alcohol, of obesity. And so a lot of the strategies in terms of improving the health of individuals was about improving the health of the community. So, you know, and it's about resources, because you've got limited resources. So how are you going to have greatest impact on the community? How do you increase the exercise levels in the community, if that's an important strategy in terms of reducing people's blood pressure, or giving people, creating appetites for people which are healthy appetites?
You know, but most of what we see can be prevented if the community is empowered with the right information, the right assistance, the right advocacy for the funding and other interventions from government and other leadership.